Well, thank you everyone for joining us this afternoon for our virtual program covering the very important topic of cancer. Here presenting today with us is Linda. She is a community outreach coordinator from El Camino Health. If you have any questions for our presenter, please use the Q&A function to enter them and we will get to them at the end of the presentation. Without further ado, Linda, I'm going to hand it over to you.
Thank you so much. Hello, everyone. I am going to share screen. Okay, thank you so much, everyone, for joining. I represent El Camino Health Cancer Center. I am the community outreach coordinator. I have a master's in public health and really excited to share about what to know about cancer to you. Objectives for today. I will share about myself, my biography, a team of experts, about our free community lung cancer screening program, resources that we offer, free community ovarian cancer screening in 2022, virtual classes support groups, and ways to support. Again, I am the community outreach coordinator for El Camino Health. I enjoy many aspects of my job, including developing survivorship wellness classes, offering support groups, conducting research studies, and managing hospital operation projects. My goal is to encourage the continued excellence of the hospital by participating in the achievement of healthier lives for oncology patients and within the community. I work with our excellent team of medical doctors and nurses. I have 18 years experience field in oncology. I also like to mention I conducted large-scale events such as our nearly about 200 people health fairs and collaborated nationally on various cancer topics. I also like to highlight that El Camino Health is located in Mountain View and Los Gatos, California. We also have clinics throughout the Bay Area, and we are one of the top 100 hospitals in the nation in quality healthcare and delivery of services as of April 2021, according to the Fortune IBM Watson Health. We are one of the top 100 hospitals. And what does that mean, one of the top 100? In 2022, how many hospitals are there in the US? That is out of 6,093 hospitals. Our cancer center received the Gold Award, and it's the highest standard of care delivering safe, high quality patient care.
I'm sorry to interrupt, Linda. I just wanted to check, were you meaning to move the slides? I'm still only seeing your biography.
Yes, okay. It's the same slide. Thank you so much for checking. The team of experts at El Camino Health, our nationally recruited oncology experts collaborate to treat cancer at every stage and support patients each step of the way. We work together to create an individualized treatment plan utilizing the latest medical advancements, provide resources for patients and their families from diagnosis to treatment, and connections with coping and healing tools. Patients can count on us to provide comprehensive cancer care that addresses the body, mind, and spirit. So we work together in partnership with surgeons, medical oncologists, nurse practitioners, pathologists, radiation oncologists, radiologists. We also have our ancillary team, which includes dietitians, genetic counselors, complementary care providers such as art, spiritual care, oncology coordinators, and social workers. We also have an on-site pharmacy team and laboratory team. So we work really well together through the continuum care process from pretty much the beginning of the patient's cancer journey to the very end. So I know we're talking about cancer, but I've selected specifically 2 types of cancer to discuss about, since there's so much to cover about all sorts of cancers. And one of it is about lung cancer. So something to think about, is lung cancer the most common cause of death in the US? I know we will have the question and answer feature at the very end, but something just to think about. And the answer is yes, lung cancer is the most common cause of death in the US. And the second question, what do you think is the national 5-year survival rate for all people with all types of lung cancer? Something to think about. And the answer is 21% is the national 5-year survival rate for people with lung cancer. So here at El Camino Health, our data for lung cancer's 5-year survival rates, beating benchmarks at El Camino Health. As we know, in the United States, lung cancer is the second most common cancer and the leading cause of cancer death. And the cancer survival rates reflect how many people are still alive after a specific period of time has passed since their initial diagnosis. And we know from the previous slide, the national 5-year survival rate for all people with cancer is 21%. However, for our patient outcome data from El Camino Health, so I'm gonna lower my, webcam. From El Camino Health, that just shows that our survival rates exceed national benchmarks. The 5-year survival rate for all patients with all types of lung cancer treated at El Camino Health is 46%. So this data is very profound and it's highly significant. So the national benchmark is 21%, whereas El Camino Health, our benchmark is 46% 5-year survival rate at, for lung cancer. And what does this data mean? So it shows the year 1, 2, 3, and 4, and 5. The first year there for the survival rate for our lung cancer patients at 100%. And then second year, 71, all the way to the 5th year, it's 46%. Age and states at diagnosis. The first part of the bar graph indicates the age at diagnosis. As we can see, it starts with 40 to 49, but then once you notice 60 years old all the way to 89, that's when it increases. Lung cancer increases with age. At the bottom of the bar graph, stage at diagnosis, remember that lung cancer is a leading cause of cancer death. And so as you can see here, their stage 1 is 41.5%. And then all the way to stage 4, it becomes 38.7%. So stage 4 is considered advanced stage of lung cancer. And so by the time patients are being detected with lung cancer, they are either appear to be stage 1, 2, 3, but it's also more found in stage 4. So early detection is key. Here is a flyer of our free lung cancer screening program. And this program was established. I built this program in the year 2021. And I know the font size is really small, so I will dive deeper and dive in. And so here is lung cancer, as you know, increases with use of tobacco use and increased age. Again, it is the second most common cancer and the leading cause of cancer death in the US. And you may be able to receive a free low-dose CT lung scan after consulting with your primary care doctor. And what are the eligibility and risk factors? Do you live in the greater San Francisco Bay Area or the South Bay? Are you uninsured or underinsured? Are you a current or former smoker with at least 20 pack years? For former smokers, the quit date should be within the past 15 years or less. And are you between 50 and 80 years of age? So very happy to share that our U.S. Preventative Task Force, it is a guideline, national guideline for cancer screening. And before it used to be between the age of 55 to 85 years of age, but seeing the data of advanced stage, by the time patients are diagnosed and receiving stage 4 lung cancer, that the age has reduced to now 50 to 80 years old of age. So more opportunities for people to be screened, and opportunities to have, our mission, our goal to detect cancer early. And our next slide, continued. Eligibility and risk factors. Are you experiencing any overt signs or symptoms of lung cancer? And that includes unexplained cough, breathlessness, coughing up blood, and unexplained weight loss. If you are experiencing symptoms, you should talk to your doctor and get a standard chest CT scan and not a low-dose CT scan. Lung cancer protective factors. Protective factors are habits that are associated with a lower risk of developing lung cancer. Lung cancer protective factors include not smoking tobacco, avoiding exposure to secondhand smoke, avoiding exposure to radon and other cancer-causing agents, leading a healthy lifestyle, eating nutritious foods and a balanced diet paired with regular physical activity helps keep the body and its cells at their healthiest. At El Camino Health, we offer the latest methods to assess a patient's risk. Once we have a risk estimate, our doctors set up an individual prevention and screening plan for each patient. If you do not meet the above criteria, a low-cost self-pay option is available at El Camino Health. I've included a website, signs and symptoms of lung cancer. And what's unique about this program is undocumented immigrants, permanent residents, green card holders, and U.S. citizens are eligible to the program. Our free community low-dose CT scan for lung cancer screening, we've expanded to Silicon Valley Medical Group, Mountain View and Los Gatos patients. We've expanded to patients who live in the greater San Francisco Bay Area and the South Bay. This program was designed originally to people living in the El Camino Healthcare District, which includes Mountain View, Los Altos, Sunnyvale, and Palo Alto, but we've expanded our program to the San Francisco Bay Area and the South Bay. And as you notice, we are a community hospital and offer free cancer screening to those who are eligible. Resources, so for more information on lung cancer screening at El Camino Health and low-dose CT scan, please call our lung cancer screening navigator at the phone number listed and the cancer center at the phone number listed. We are located at Mountain View, El Camino Health Hospital, and also Los Gatos, El Camino Health Hospital. And the free community low-dose CT scan is sponsored by El Camino Health Cancer Center. And the lung cancer education program is provided by the El Camino Cancer Center, El Camino Pulmonary Health, and also El Camino Health Imaging Services. So moving on to the second cancer topic, is there a preventative test for ovarian cancer? What do you think? All right, I'm going to answer. There is no simple and reliable way to screen for ovarian cancer in women who do not have any signs or symptoms. Screening is when a test is used to look for a disease before there are any symptoms. Cancer screening tests work when they can find disease early, when treatment works best. Signs and symptoms of ovarian cancer includes abdominal bloating or swelling, weight loss, discomfort in the pelvic area, fatigue, back pain, changes in bowel habits, such as constipation and frequent need to urinate. I've included a flyer of our free community ovarian cancer screening, and this was only offered last year in 2022. Again, emphasizing that we are a community hospital and that we try to engage the community and educate the community and also create the cancer awareness to our community and how important it is to detect cancer early and prevention and understanding about treatments and cancer screening. So ultrasound is often the first test done if a problem with the ovaries is suspected. It can be used to find an ovarian tumor and to check if it is a solid mass tumor or a fluid-filled cyst. It can also be used to get a better look at the ovary to see how big it is and how it looks inside. What should you know about screening? So pay attention to your body and know what is normal for you. If you notice any changes in your body that are not normal for you and could be a sign of ovarian cancer, talk to your doctor about them. Ask your doctor if you should have a diagnostic test, such as pelvic exam, transvaginal ultrasound, or a CA-125 blood test if you have any unexplained signs or symptoms of ovarian cancer. These tests sometimes help find or rule out ovarian cancer. So this program was done back in November last year, and we hosted one event at Mountain View Hospital and one in Los Gatos. And we had a total of, I believe, 10 participants that were screened and met the eligibility. In the orange, they were a candidate for screening if they were women over age of 25 with a family history of ovarian cancer, woman over age 50 with no symptoms or family history of ovarian cancer and live within 25 miles of Los Gatos or Mountain View. And we conducted using the transvaginal ultrasound, TVS. Ovarian cancer ranks 5th in cancer deaths among women. A woman's risk of getting ovarian cancer during her lifetime is about 1 in 78. The chance of having ovarian cancer goes up with age. And this is an important screening to test for ovarian cancer. So out of the 10, we had, we found 3 that had abnormal signs of ovarian cancer for basically for further follow-up screening and to speak to their primary care physician to see if they need to be referred to gynecologists. So out of the 3 were followed up, and also we're really appreciative that they were able to detect something, either a fluid or there was some sort of obstruction, or a cyst found in their ovaries. And so had they not had the community participate in the free community screening, those 3 would not have known about their potential for ovarian cancer. Moving on to what El Camino Health Cancer Center offers. And no, actually, sorry, I'm gonna go back and discuss a little bit more about ovarian cancer. So what are some ways to reduce risk of ovarian cancer? I have to mention about that. There is no way to prevent ovarian cancer, but things associated with can lower chance of getting ovarian cancer. And it is such as breastfeeding is one of the ways. And clearly is the key is having a discussion, communication with your doctor to reduce the risk. Okay, here at the Cancer Center, I'm really happy to share that we offer classes and support groups for our patients, cancer survivors and caregivers. We offer exercise classes, and currently we're meeting virtually. Before it used to be all in person prior to COVID-19, but ever since the pandemic started, we've continued to conduct the classes virtually online via Zoom. And these classes are offered for cancer patients, survivors, and caregivers. And we offer such as Qigong, which is the slow base, similar to Tai Chi, breath work and restorative yoga, which is more meditation and breath work, and yoga for healing, which is more movement and flow, oncology exercise class, and that's with our physical therapist and occupational therapist. And that's more of a customized program where if a patient has any certain issues with their mobility, they can consult with that, and it's a group class. Oh, sorry. Healing Cancer from Within is an 8-weekly online classes discussion, and it talks a lot about the emotional aspects of cancer, followed by meditation and yoga. The support groups we offer at El Camino Health Cancer Center, it includes our cancer support group, which is a general cancer support group. They meet twice a month. Our breast cancer support group, they meet, and we have a healthy young attitude, a young adult cancer support group, and a thyroid cancer support group. So this is all engaging conversation, and it's confidential. It's led by a support group facilitator. And a lot of our cancer patients and survivors develop camaraderie and friendship from the support groups and exercise classes. And all of this are offered free of charge. Again, I like to emphasize that we are a community hospital, and we really care about our patients and our cancer community who experience that in part of their lives, and offer this and try to have less burden to their lives, but instead enhance their quality of life and well-being. And ways to support the Cancer Center. So I'll be discussing that in the next couple of slides. And so we have community in-kind donations, and for our patients at the Cancer Center, Infusion Center, for instance, we had the community donate teddy bears to our patients. And what is remarkable about the teddy bears program is that when our cancer patients complete their chemotherapy, their cancer treatment, they will receive a teddy bear to congratulate them and to wish them well on the next chapter of their lives. And so we offer that to our patients, and we also accept that as a community in-kind donations. We receive monthly Healthy Snap donations from the community, and that includes, for instance, gluten-free cookies to our patients. And our blankets are also donated by the community. They're regularly sewn, and there's also a heart fabric that's sewn onto the blanket, which is a really nice touch to the patient. And so, so if something that you are interested in giving to the community or giving to the cancer patients, we accept these items if are interested in participating. Ways to support, we distribute positive cards to patients, and I've included examples what a patient receives, and these are my 4 favorites. Be strong, you got this. Sending you faith, hope, and strength. You are the strongest amongst us with the heart. You are strong, special, spectacular, and I love the vibrant colors. And so that's it's when I hear from a patient, it really helps them to receive a positive card. It really helps them make through the day. It brightens their day. It's so positive, and it makes their treatment much easier as they're going through hardship of cancer. So that's some of the way the community likes to support to our cancer patients. And also ways to support, we're looking for cancer center volunteers. And if you're interested, perhaps interacting with our patients, or if you yourself are a cancer survivor or had a family member with cancer, and you want to give back and support our cancer center, we're searching for volunteers. And do you love working with patients and projects? Are you energetic, professional, and personable? And you're welcome to contact me at the cancer center with our main hotline number included. And so now that concludes my presentation. I'm ready to go forward with questions and answers. I'm glad to share our 2 types of cancers, lung cancer and ovarian cancer prevention and screening, services that we offer, that we are a wonderful team that collaborate together to help each individual cancer patient, and also ways to support if you are interested volunteering at our amazing cancer center and volunteering for and supporting cancer patients. Please contact us, contact me. All right, and so we will move on to questions and answers. And
yeah, let me help you with that a little bit, Linda. And folks, if you could use the Q&A function when you're entering your questions, that would help us keep track of what's been asked and what's kind of gets filtered through the chat. But I see a few already in the chat function, so I'm going to go down it and kind of along. Yeah. Again, Minna had asked at the beginning if we will be making a recording of this webinar and passing along the PowerPoint. For those of you who missed that question, yes, we are recording this event, and we will pass along the resources via email. From Matthew, we've got a question. Does ECR have other non-CT low-cost screening programs, such as skin cancer screening?
Sorry, I'm trying to cancel the screen share.
I'm still seeing Camino Health.
Okay, so pause, share, stop share.
Yes, there we
go.
Is that
better?
Yes.
You can see Brian and I, Linda. Okay, great. Any other free cancer screening, such as skin cancer screening? Currently, we do not offer free community skin cancer to determine melanoma, but we did in the past, and that was probably, I would say, at least 7 or 8 years ago. We offer that free to the community, and we tend to rotate different types of free community cancer screening. And for this one, we currently are conducting free lung cancer screening, and last year it was ovarian cancer screening. But lung cancer screening is currently ongoing, and we have funding for that because lung cancer is the leading cause of cancer death.
Another question, this one from Chris. What is the cost approximately for the self-pay LD scan for lung cancer?
Yes, thank you so much for asking that. From the top of my head, I know I've written it down somewhere, but I think it's no more than $280. I think it's around $250 to $280. And at El Camino Health, it is so far that I've seen very low cost compared to self-pay at Sutter Health or Stanford Medicine. And again, we at El Camino Health, we really emphasize that we are a community hospital.
From Catherine, we've got the question, will El Camino be offering the ovarian cancer screening this year in 2023?
Oh, thank you so much for asking that. And so we offered that end of last year, and I believe this year, no, we won't be offering. Sorry about that. We're hoping to. I have to get approval by our medical doctors. We're hoping to offer free breast cancer screening this year, which is free mammogram, along with our lung cancer screening.
Another question from the crowd. My sister died of ovarian cancer at the age of 72. I took the drastic measure of total hysterectomy when I was 60. I have unexplained weight loss now. Do I need to worry?
Thank you so much for sharing that. But I'm so sorry about your sister, and you took a proactive measure for yourself. I would say consult with your primary care physician, and if your physician may refer you to a specialist if you're concerned about weight loss, and if you're unclear why that is happening, I would advise you to speak to your physician. And thank you so much for being aware about that and asking about that. Thank you.
That seems like a better safe than sorry kind of thing.
Yes, exactly.
Let's see here. We've got some comments. Okay. Is there a website with more information for in-kind donation?
Oh, thank you so much for asking. Websites, I can, if you Google El Camino Health Cancer Center or El Camino Health Foundation, those are the two primary places. But you're also included on the slide is the main hotline number, and you're also welcome to call and inquire about donating, and we welcome in kind. And also, if you have time to volunteer and interact with our cancer patients, and that really helps too. It's interaction and the opportunity also to work with volunteer and on the nurses floor too, and that really helps. So thank you.
Thank you for asking. I'm not seeing any more questions in the chat or the Q&A. I'm going to give folks final 30 seconds to see if there's any more questions that pop up before we wrap things up. Here we go. I did a calcium score some years ago. Is it something I can redo to follow up on how I'm doing without a prescription?
Could you explain, Chris, the calcium score? What is that for, if you don't mind? Because I know my presentation, I focus specifically on lung cancer and ovarian cancer prevention. Is it calcium?
More details you can provide us?
Yeah, for blood calcium risks. I think that's probably more of a outpatient laboratory kind of question, anything with blood tests, or also a question that goes to your physician. Since this is more of an individual health question, I would refer you to speak to your physician or whoever conducted this blood test. But I personally don't have a good answer about the calcium score. So, but I wanted to highlight is the low dose CT scan for lung cancer and the transvaginal ultrasound for ovarian cancer. Those are the two excellent screening tools, tests to detect those cancer. However, ovarian cancer is a little bit more on the challenging side because it's really difficult to detect. So you may require another one or two other screening tools to determine for ovarian cancer. So yes, any other additional questions?
Not seeing anything in the Q&A, nothing coming in the webinar chat.
Yes, and
So,
maybe maybe in the email when Bryant sends out, I can include the web links of our cancer center and also ways to support.
Of course,
And,
of course.
yes,
Linda will be passing me along all the great information she shared, and I will make sure to get it to everyone who signed up. And we'll make sure the recording's available as soon as we can get it up onto our YouTube channel. And again, I'll share those links once they're live.
yes.
I see no more questions. So with that, I want to thank everyone for joining us, and especially Linda for sharing these important resources with our community member. I think, every little bit helps. For those interested in more either in-person presentations or virtual presentations, do visit our website, sccld.org/events, to see the next Great Library event that we're putting together. And if there's nothing, if there's no further questions, I will, and Matthew, I see your question. I will send the link in the email as well to our YouTube channel for all our other programs that we've recorded to everyone when I send those out. With that, did everyone have a good afternoon?
Yes.
Take care of yourselves. And
I want to thank Bryant and
Yeah, of
also
course.
Los Altos Library, and thank you for joining in today. I know it's January and we always say New Year's resolution, right? But try it's the beginning of the year, and
yes, stay
I'd like
healthy,
to
everyone.
encourage you to remember to exercise. Don't forget about talking to your physician about screening, and also importance of healthy nutrition. Thank you so much and have a great rest of your day.
Yes, take care, everyone. Happy 2023.
Happy 2023.